Today I'm going to be talking to you about the topic of experiential therapy. And what we're going to learn are three different things. Our learning outcomes are the following. The first learning outcome is I'd like you guys to understand and be able to define what experiential therapy is. The second outcome is to be able to list or to talk about the most common forms or approaches to experiential therapy. And those are up on the board there, and we're going to talk about it in a little bit. And the third one is to learn about HTP. And HTP stands for House, Tree, Person. Some of you may have heard of this, some of you may not. Hopefully everybody's heard of a house, a tree, and a person. But in that order, in that combination, it is an art assessment test. So the three things we're going to talk about today: defining experiential therapy, identifying the top 6 forms or approaches of experiential therapy, and then 3, learn about the HTP, which is a branch of art therapy. Okay? So that's what we're going to talk about today. Experiential therapy, by definition, is a therapeutic technique that uses expressive tools such as art, music, sculpting, going out in the wilderness to reenact or to re-experience a traumatic situation, and eventually identify these emotions with and associate them with success. So instead of having these horrible memories of an experience, we'd use these experiential tools, and we're able to provide a deeper understanding of their trauma and identify it with success. This is very, very effective for adolescents that struggle with either a dual diagnosis of a mental health disorder and a substance use disorder, or adults and adolescents who have just an addiction. They find that using this type of, usually it's wilderness or recreation therapy that they use. They go out in the woods, they're one with nature, and they're able to separate themselves from the trauma or the addiction that they were going through. There are quite a few different tactics that people use. I like to call them tactics because it's tactile, very hands-on. There's a lot of different approaches that therapists use when it comes to experiential therapy. Today, I would just want to talk about the top 6 that are pretty most common. And I don't know if you can see up here. We have art therapy. Art therapy, you don't have to be an artist. You can just draw, sculpt, talk, all that. Recreation therapy, which is more of a sport. It could be, dirt biking or basketball or some kind of individual sport that people are good at. Role play. Role play is a tough one. Role play is kind of hard at first to grasp, but it's when you take on, you just role play the therapist, and actually there's a thing called the empty chair where you can just sit in the chair and talk to the chair as if the chair was you. That's a different kind of role play. Equine therapy. Equine therapy can be horses, donkeys. We have miniature donkeys at our therapy ranch, and you'd be surprised. It doesn't even have to be equine. It can be animal therapy. Animal therapy in general is just an amazing tool. Someone comes in and they're just angry and scared and frustrated, and they sit in a bunny pen with a couple bunnies, and by the time they're there for 5 minutes, their emotions are completely different. So we have art therapy, recreational therapy, role play, equine therapy. Music therapy is another common tool that's used, not just listening to music, but playing a piano, playing an instrument. And wilderness therapy. We're here in Colorado, and wilderness therapy is a huge, huge tool that a lot of different mental health facilities use. They call it recreational outdoor sport or outdoor adventure sport, where they take people and they just go out, and you are in a tent. You're figuring out how to survive. And how to survive without your addiction. So it's very, very impressive and very cool, and a technique that people have been using for quite some time. Today, I want to focus solely on art therapy. It's one of my favorites. I've used it with little kids, I've used it with adults. And art therapy, people think, oh, at the beginning, I have to be able to draw. I'm not a good drawer. I'm not. Well, this is different. This is projective art. You're given an assessment, for example, of something. Let's draw this, 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 and this, and there's a parameter. And what is really, really neat about it is while these people are drawing, they're talking to you. You know, they're sharing things. And I'm not 100% sure why it works, but it does work. And over time, this has been an approach that people have just used for many different things. And it is just short of miraculous how someone can just sit there and draw, and next thing you know, they're talking to you and sharing some stuff. So what we want to do today is I want to focus on art therapy. I want to focus on mainly an assessment, and I'll explain to you guys how it works, and we'll try it amongst ourselves, and then we'll kind of analyze what's being drawn. Projective art, and one of the reasons I started studying this is because I just thought it was impossible for someone to take my paper, look at it, and tell me about myself. But thousands and thousands and thousands of people drawing the exact same picture and the exact same placement on the page with the exact same type of whatever was being told to be drawn. And it reflects the same thing, the same either trauma, the same type of family life, the same whatever. So what I'd like to do with you guys today is I'm going to hand out some papers, and I'm going to have you guys do one particular assessment test. It's called the HTP. It's called the House Tree Person Test. And I'm not going to tell you anything else, and no questions. We'll just play some music in the background while you guys are drawing. So take these papers, and that's all I need you guys to do, is draw a house, a tree, and a person. Okay, guys, let's pass those papers up. And first of all, is everyone okay with me sharing a couple things or asking a few questions? One of the things with art therapy is you generally like to do these in an individual setting, not necessarily a group setting, because I don't want to like pick up your paper and be like, oh, and like explain some trauma that happened, which you wouldn't want to necessarily share with somebody else. So for this purpose, I'm basically just going to do the main basics and explain how the House Tree Person Assessment works. And everybody's okay with that? Perfect. All right, let's see what we have here. Very basic, which is fine. We have a house, a tree, and a person. And the first thing I'm going to say before I explain everything is just looking at this, I already know that this person, I'm not sure whose it is, this person is a firstborn, probably a firstborn female. And we'll get back to that in a second. This one here, another one. We have our house, our tree, and our person. The first thing I think of when I see this, and we'll get into that again, is this is probably a gentleman or a boy, and there might be a little bit of anxiety going on here, but definitely, and I'll explain that in a bit too. This is another one. Got a house tree person and added some windows and a sun. This one, not just because of the sun, but this one's interesting. They're pretty optimistic, which is kind of cool. So let's go through a couple things real quick. The instruction was simply to draw a house, a tree, and a person. That could be anything. It could be absolutely anything. And so, generally speaking, when a child is to draw a house, a tree, and a person, they would draw theirs like this. Very basic. You have the house, the tree, and the person, and I threw in a sun there. Now let me explain this very childlike, I guess. I do not see in this picture any signs of trauma, and I will explain further what I mean by that. This is a basic house. It's interesting, a tree and a person. Can't tell if this is a guy or a girl, but that's okay. And there's a sun in the picture. I didn't ask anybody to draw a sun, but when you draw a sun, placement on the page is key. And you remember in this picture right here, I said that this picture or this person was optimistic or not depressed, which is a good thing. Am I right? I'm right. So a child or someone who is just basically carefree draws their picture of the sun on this side of the page, on the left-hand side. And that is because the sun rises and the sun sets. So when someone draws a sun over here, what is the sun doing? It's setting, that's correct. So setting sun is generally a sign of depression. So if you have your picture in the sun in the middle, sun on this side, optimistic, things are fine. A sun on this side, when it's setting, some people do it in the corner, like a corner sun like that. That's a sign of depression. And why a kid doesn't generally do that is because they don't really understand the concept of depression. They are not, they don't have to worry about finances. They don't have to worry about anything, really. They're provided for, unless they come in a really abusive situation. But they still, depression is a little different for a child. So that's the first thing. Next thing, we'll talk about placement of this. Remember the other time or a few minutes ago, I just said that I believe that this person is a firstborn. Generally, after thousands and thousands of the same pictures being drawn, the same people that are firstborn, with exceptions of course, but generally speaking, a firstborn does exactly what we tell you. We said to draw a house, tree, person. They drew a house, a tree, and a person. So am I correct on this one? You're firstborn. So they generally follow rules. It's very interesting. Type A people. So yeah, you got a house, a tree, and a person. That's a firstborn. When we talk about the tree, now if I look at some of these drawings, this tree here is dark and kind of scribbly. This tree here has a little circle in the middle. Some people call that like a foxhole or squirrel hole or whatever. Let me quickly explain the tree. It's kind of interesting. So if you had a tree, a general tree, that just signifies you, your life, how things are going. When somebody starts drawing a circle or even additional branches or apples, anything additional to the tree, whether it's a little mark or not, these in here are signs of trauma, okay? And what I mean by that, let me take my other pen and we'll talk about that. This, the bottom part of the tree, is when you were born, okay? So if you are 0, I guess, when you're born, so that's you at 0. And the top part, wherever the top of the trunk ends, is how old you are today. So for the sake of this, let's just briefly say, okay, this is somebody in their 20s, okay? They're 20 years old. So you start up the tree and you see there's these lines here. Remember I said any line or dot or anything in the tree. This one had a circle. This one is pretty dark, is a sign of trauma. Trauma, when it comes to this assessment, can mean anything. It could mean something as huge as a death or, something very, very traumatic that people experienced. Or it could be something, trauma to different people are different things. It could be a senior in high school who had to move, and they were like a star basketball player on the team, and all of a sudden they moved across country, and they're a senior, but they're no longer, the popular kid or whatever, and that's pretty traumatic for a teenager. So we're going to focus on this circle right here. So if you go up the line, start at the bottom, and let's do some math here. 0 to, mean, that's a little over halfway up there. So let's say that's like, I don't know, maybe close to 10 years old. Let's say 9 years old. 9 years old. And then it ends up here. So that's probably about 15 years old. So somewhere during age 9 to 15, something pretty tough happened, because it's a mark in the tree. And that's where we would focus. I'd be like, okay, so do you remember anything at 9 years old? Anything that sticks out to you that happened? Well, my parents got a divorce. Well, okay, that's huge. That's tough, especially for a kid. And that's when we start talking about that. The different trees represent different families. So it could be a split family. And the kid at 9 doesn't know, okay, do I go with my dad or do I go with my mom? When I look at these pictures that people drew here, it would depend on how old you were, and we would talk about that part of your life. This is not a fortune-telling thing. It's just, again, thousands of people that went through divorce or had a trauma or had some kind of experience with their family. They draw the same thing. So, anyway, so that briefly explains the tree. You had a question? About the apple. Very good. I was going to that next. So, again, generally speaking, usually women draw apples in the tree. If men draw apples, it's usually a sign of a need for nurturance, or, it's nothing bad. It's just someone that needs more nurturance. When a woman draws an apple in the tree, it's usually a sign of fertility. There is, children or babies or whatever. So that's what the apple in the tree is. And quick story, I was doing an assessment for kind of not an icebreaker, but it was for a huge, probably about 25 people in this addictions class. And we were talking about different things or whatever, and I looked at the way end of the table, and I told myself, Angie, don't do it, don't do it, don't do it, and it came out of my mouth. And I asked the lady, are you pregnant? Because I noticed way at the other end, she had a bunch of apples in the tree. And everybody looked at me, looked back, and I'm thinking, oh, now I did it, Well, she started to cry. And she was, just a little upset, obviously. And I thought, great, this is wonderful. I did it. Turns out, she says, actually, I just had a miscarriage yesterday. And everyone was like, oh my gosh, and they felt bad and everything. And I was a little confused because the apples usually represent, fertility or, the baby or whatever. Well, while she was talking, and again, I'm looking down the table, she picks up her glass of water. And when she did, I noticed there was a little apple on the ground. And had I seen that at the beginning, I probably wouldn't have mentioned anything, because an apple falling from the tree was kind of a sign of passing away or death. And it was kind of confirming that the study that we've been doing for quite some time is, it's pretty neat and it's pretty on point. I don't recommend doing this in a group setting when you're talking about things like that. So that was tough, but it just showed. And she was like, this is really kind of neat. I needed to talk about this, and I'm glad I can do it in a safe setting. So God works things in kind of mysterious ways, and that thing worked out. Remember this picture we talked about? I talked about what did I say? Yes, I said that there's maybe a little sign of anxiety. And I'm not trying to diagnose you or anything, but when people draw lines that are not necessarily straight, they're more rugged, like the rest of your picture is perfectly straight lines. But this tree shows like the little bit of aggressive lines, and that's a sign of either, just mild anxiety. And that's, if I looked at that right away, that's what I would start talking about. So you can see how very quickly you can look at some of these pictures and just be like, well, let's pinpoint that. Let's talk about that. And a lot of times, people don't know why they're coming to therapy. People don't know what it is, what the root of the problem is. They know they're angry, they know they have an addiction, they know that they have a problem, but they don't really know why, and especially in that moment. So this is a good assessment to just look at real quick and be like, okay, well, there's signs of trauma, there's signs of anxiety, there's signs of depression, there's signs of divorce, there's signs of, different things like that. And we could talk about this for a long, long time. Looking at this, I see you have two windows, you have a little door, you have a welcome, like a walkway, you have a doorknob, you have little smoke signals in there, and all in all, this looks like a very nurturing and very welcoming home. But when I quickly look at this, I see guarded, and you ask how? Well, right here on the windows, even though we all know these are window panes and they're just that's how you draw them, it just shows almost like a fence, like a block. Like, I want you to come in. I have a doorknob. I have like cookies baking in the oven, but only for a little bit. I want to keep you at a distance. So that's kind of a sign for that. I also see, to me, like a split family, or we got a small and a big one, so it could be distance. Split family doesn't necessarily mean a divorce or a death or anything. It could just be distance. Whoever this is closer over here than this tree is kind of over by itself. So when you look at different assessments, you look at them also linear, like lines. So you have this part over here, this part over here. I would say similar about this picture. Even though we know this is a full house, it still has a line. Some people draw a garage, and the garage, they're like, well, it's just a garage. And then I ask them, well, do you live with your family? No, my family's in Wisconsin, and I'm in California. So it just shows a split. It's very interesting, too. I did one of these assessments for a group of individuals who were all Hispanic. They were all, the whole family, like all the guys that were in this class were originally from Mexico. And except for one person, everybody drew two homes. And nobody was looking at each other's page, they just drew two homes. So it was very interesting to see, because a lot of them worked in the United States and sent money home to their family. So that's kind of cool. The person, that's a very long, drawn-out topic that we can get to another time. Numbers, placement on the page, like this one, it's not necessarily grounded. A child usually draws a line and then draws the pictures on top of the line. We can quickly talk about a person. If you were to draw a person and they had all the features, all this kind of stuff, big, remember, you don't have to be an artist, big hands. Each thing represents something different. He would be a good listener, but he's also very, very confident. And you can tell that by the hands. I'm a fairly confident person, and I never drew hands, partially because I didn't know how to draw hands. So I would always draw the person either with their hands behind their back or their hands in their pocket. And one therapist told me once, you have a little problem with self-esteem. And I'm like, what? I'm pretty confident. And that sign, without having your hands and just drawing them like that, is a kind of a low self-esteem or not as confident. And truth be told, she's absolutely right. Whereas my job and my recreational activities exude confidence, I do struggle with that at times. So it was just really interesting. A lot of people will draw every feature and no ears. I drew ears on this one. or they'll draw a nose, and we can talk more about that. If you have questions later, we can discuss it. Um, so that's basically it. That is the house tree person assessment. There are many, many different assessments. There's one of them is called a person in the rain, and that's determining how well people can withstand external circumstances, how prepared they are. Some people just draw a person standing there with lightning and thunder. You can't really draw thunder, but lightning and rain and everything, and they don't even have an umbrella. And that is somebody who's just not protected or whatever, but is capable of handling some stuff. Other people have like the galoshes, the hat, the umbrella, they're standing under a tree, they're under a garage, and they are very either insecure or they're completely prepared for anything that life throws at them. So that's another one. There's an assessment about draw an aquarium, and that assessment is based on different family dynamics. So, like I said prior, we can talk forever about different types of therapy. You can sit down and talk about cognitive behavioral therapy. You can do EMDR. But what I've found working with teenagers is sometimes they need, we can call it an icebreaker. They need something hands-on that they'll, open up to you about or remember. A couple weeks ago was teaching a class, 10 kids, and they all had severe mental health disorders and severe gang affiliations. They had addictions, meth, heroin, not just weed. We're talking the big stuff. And within the 10 kids, there were Crips, there were Bloods, there was the Sinaloa, there were like all these different gangs. And here I am thinking, okay, we're gonna make jewelry today. Nobody in their right mind would sit down with these kids and do jewelry. For 4 hours, you could hear a pin drop. We had some music playing in the background. We were all using the beads, the jewelry, making bracelets and necklaces and all this kind of stuff. And for 4 hours. I looked up at the time, they looked at the time, they couldn't believe that they had been sitting there that long either. Everyone talking to each other, everyone passing things around, and, nobody was disruptive. And it just goes to show you that changing the focus from, the drugs, the addiction, the meth, the gangs, to something productive opens them up, and it gives them the opportunity to not just talk to you, but to hone a new skill. And that, my friends, is what experiential therapy is all about. You can do art, recreation, role play, equine, music, wilderness. Choose any one of those, and you'll notice a huge, huge difference. So we talked about the learning outcomes at the beginning, learning what the different topics were, what the common forms of art therapy were, and we also talked about what the definition is. Can someone read this? Yes, it's a therapeutic technique that uses expressive tools to reenact and re-experience traumatic situations and to identify these emotions and associate them with success. Does anyone have any questions? Yes. That's a good question. I'll repeat it so the camera can hear. They were asking if there is any special training that is needed before performing these assessments. If you're doing it, that is a good question. I am a certified art therapist. I have trained with the HTP specifically for close to 15 years now. I was an apprentice under a doctor that's in Florida that specializes in this. I do believe that you can't just sit down and know what all of this means without some kind of training. The art therapy that I'm basically talking about that you would use with your client could just be something very basic. You don't have to get into full-fledged details because truthfully, these pictures, when conducted by a CAT, Certified Art Therapist, some of these are admissible in court. If you were to, I'm going to just do this very briefly. If there was a person that had a window up there, you guys, oh, it's an attic, oh, yeah, great. It is, they consider this a fantasy window. Now, a fantasy window, someone drew one over here. In this aspect, I'm just going to throw it out there, but are you a video gamer? You are, yes. So, the fantasy, you're a boy and you play video games. There's nothing wrong with this. That's very, very active mind. However, if the person that was given this assessment was a man, an older man, and they drew I don't know if you can see that. That's a little girl in the tree. You have a fantasy window there, and my first question would be, are you in this picture? And they're like, no. Okay. Well, we have a little girl. Do you have children? No? Okay, so this could be, and I don't want to get too deep into this, but this could be a sign of pedophilia. And they got a fantasy window, right? They got a little girl in a tree here, and none of it really goes together for them. So that's when this becomes even more in depth. And yes, some of these projective drawings are admissible in court. So that was a very good question. 3 learning outcomes we had for today. First one, yes, to define what experiential therapy is, which we did. Second one, yep, to name the top 6 or most common forms of therapy, experiential therapy, and that was art, recreation, role play, equine, music, and wilderness therapy. Those are the 6 top. What was the third outcome? Perfect. Yes, to talk about art therapy specifically, and to learn more about the HTP or the House Tree Person Assessment Test. Very good. All right, thank you for coming. Don't worry, I'm not going to admit any of these into court. You guys are doing fine. If you have any questions afterwards and want to talk one-on-one about anything that was talked about today, I'd be more than happy to do so. Thank you so much for coming, and God bless you.